All right, guys, so I am headed into the hospital. It's really nice to go into the hospital when it's still light out because for the rest of the year in the wintertime, when I go to the hospital, it's dark. And then when I get out of the hospital, it's still dark. And so it's really nice in the summer months that I get to see a little bit of sunlight before I go inside. But you just saw my morning routine. It's really pretty quick and easy. I usually wake up literally like 10 minutes before I get on, before I need to leave. But on days when I have to take out Ozzy, I wake up much earlier. And the only thing that's super important about my routine is getting my cup of coffee, and I usually take a bar to go and I eat it on the way. And that's pretty much my breakfast. So things are definitely a little bit different in the COVID era. You always have to wear a mask inside the hospital. I generally wear a mask outside the hospital as well. And then I clean out as soon as I get to the hospital. I just change out my scrubs. I pick up my N95 mask, and then I am good to go. Okay, so I just changed into scrubs, and basically the flow of my day now, we go to morning rounds where basically the overnight resident gives the entire team an update about all of our patients on our list. We'll go through vitals, things that happened, important things to know about the patients, and then as a team we'll go through kind of a plan for the day. And since I'm the person who's holding the pager, I have my list of patients. I'll write down little tasks about all the things that need to get done today, and during the day I'll find time to do to them in like a priority list. Basically, that's always the best way to go about it, and it's so important to stay organized. And then basically I'll hold the pager for the rest of the day, waiting for new consults, pages about our current patients, post-op checks if we have patients in the OR, and then in between all of that, during the day when our same-day clinic is open, I'll be hopping in and out doing procedures during the day. And so when you're the whole person holding the pager, you have a lot of different tasks, and it can get overwhelming, especially during the day since our clinic is open and then we have to do all of our inpatient stuff. But later in the night when everybody goes home, things are definitely a lot calmer, and I'll show you guys what that looks like tonight. So pre-COVID, we would always examine patients with gloves and a mask and eye protection, and now things are a lot more intense. PPE is a lot more important, and for good reason. So before clinic starts, I usually get ready for the day. I put on my scrub cap to just protect my hair and make sure it's nice and clean, because I know that I'm going to be doing a ton of aerosolizing procedure. Oral surgery is all aerosolizing. We're working in the mouth, lots of drilling, lots of saliva, so it is aerosolizing. And I love these scrub caps because they have these buttons, and so I can put my mask over it and it doesn't kill my ears. But also have to wear an N95, and generally speaking, we pick this up in the beginning of the day, but if we're doing an aerosolizing procedure, we have to wear another one. And then I cover my N95 with another mask, and then I am ready to go. I have to say that it is much harder to be in the hospital with all of this PPE, but it's for your own safety and patient safety as well, so we have to do it. I just finished a procedure. I was doing an extraction, and then I got a consult, so I have to get on the computer, figure out what's going on with this consult, what's going on with this new patient. And when you're the person holding the pager on our service, you're like running around doing a little dance between procedures and patients and pagers and all of this different stuff. So it does get a little bit crazy, a little bit busy. We also have 2 ORs running right now with different patients that are going to come out. They're going to need post-op checks, and the person who's holding the pager also has to do that. So being on call is definitely, I get a lot of steps when I'm on call. It's definitely a little bit overwhelming, can be a little bit difficult, but the key is to always stay organized. And so I always have a handy dandy list with things that I need to do with all of my patients, and I literally check things off as I get them done. And that's super, super, super important for organization. So we're fairly gowned up because I'm about to see a patient. N95, face shield, scrub cap, mask, gown, 2 pairs of gloves that I haven't put on yet. And that's how it is in the COVID era. So it's lunch hour and everybody's eating outside because it's a beautiful day. I have to run a few errands, and so I ate my lunch on the go. I usually try to bring something from home. I had some leftover pizza that I ate today. Okay, you guys, so I am running to do a post-op check on one of our patients who just got out of surgery. Usually the post-op checks happen 4 hours after surgery. We just have to make sure that the patients are doing well after surgery. Their pain is well controlled. They're ambulating, tolerating clear liquids, and they're not nauseous, no big concerns. They're hemostatic. The surgical sites look nice and clean. Those are kind of the main things that we look at, do a cranial exam. So lots of things to do, and then we make sure that they're good on their post-op check. Okay, so I'm gonna do my post-op check, but right before I do a quick stop to the supply room to get some of my handy dandy tongue blades. Oral surgery residents always have tongue blades stashed in their pockets, as well as pen lights. Those are like super important when you're looking in someone's mouth. And just FYI, you guys, I love the supply room. Okay, so we just finished clinic, and I basically updated the patient list to figure out what's going on with all of the patients while I was running around doing all of the different tasks of the day. And now I am going to quickly go around with the senior resident who is on call today. We'll go see the patients and check up on them, make sure that they are doing well, and that will be it for evening rounds. And then I'm gonna go back to the resident room and do a bunch more work. Hey guys, so it is about 7:30 p.m. and I am the last resident in the resident room, which means I can take off my mask and get comfortable because I have a ton of work to get to. This is when the hospital starts to get quiet, but there's a lot to do when you're on call. But actually tonight I am accompanied by some of my co-residents and attending because one of the ORs is still running. Because of coronavirus, lots of people had their surgeries pushed back, and so we are just swamped, and we are scheduling tons of surgeries during the day. On a typical day, you know, before everything went crazy, clinics, generally speaking, end around 4 or 5 p.m. and the ORs are usually done by that time as well. The only time that we go to the OR late is if it's a trauma patient or an infection or something that needs to go urgently to the OR. But generally speaking, things start to slow down around 4 or 5. Most of the time we'll sign out about 5 p.m. And then the night resident will start getting to work at that time. But now things are a little bit more hectic and our days are a little bit longer to try to catch up, which means that I'm going to have to do a post-op check fairly late today, but that's okay because I have a ton of work that I need to do anyway. So in the meantime, I'll get ahead and start to get all of my notes in order. It's, you know, being an intern, I've said this multiple times, it's all about organization. So this is the time when I start getting down into my checklist. And so I have my patient lists, and every patient has a specific box with different tasks. And so most patients will always need a progress note every single day, and they'll need their we need to update basically what's going on with them in something that we call a handoff. And so those tasks have to be done every day, and we're such a busy service that we actually do them late at night, and then the next day we just update them as needed and then make sure that we sign them. And so that's kind of a night resident task. The other things that needs to get done on my list are meds, ordering people's meds, making sure people's discharge summaries are in order. This is always prepared for people that are going home the next day. Make sure that we can order their outpatient medications so they go home with the right meds. And then of course I have all of my different post-op checks written down at certain times, and I basically go through one at a time and make sure that every single patient has everything they need, because tomorrow we are so busy I don't have time to do all the work that needs to be done overnight. And so I'll just go through all of the different tasks in my list, and this I keep in my back pocket. Tells me where my patients are, tells me what's going on with them, their meds, their past medical history, and all of my tasks, which is super important. So that's basically my flow at night. I'll get on the computer, start doing all of my notes. I've already seen the patients that I needed to see with the on-call senior resident, and then now I have to do all of my tasks for tomorrow. So you might be wondering why I'm not showing you some of the procedures that I'm doing, some of the surgeries, and what exactly I do in the hospital. And the reason why I'm not doing that is because of something called HIPAA. HIPAA is a very, very strict law to protect patients' privacy. And so I can't reveal patients' names. I can't talk about specific procedures. And so I keep things as general as possible, make sure there's no patients behind me, and try to protect our patients because patient privacy is a top priority. And so doing these day in the life life in the hospital can be really, really tricky, but I know a lot of you guys ask for them, so I'm trying to share as much as I can so you can see what a day in the life is, but also my patients are my top priority, so I have to make sure that I'm always protecting their privacy, which is why you don't get to see a lot of my procedures, sadly. Okay, so since we still have patients going in the OR, I'm actually going to go into the OR, check in on our attending and my co-residents, see if they need anything. If they need me to scrub them out, and then see where the night takes us. Okay, so I am done with everything that I needed to do tonight. Otherwise, I'm gonna go home, get a bite to eat. It's like 10:30 p.m. and I still haven't eaten anything for dinner. So going to get a bite to eat, do a couple more notes, and maybe get a couple of hours of sleep. So no matter how tired I am, you guys, I am always going to take care of myself and do my full skincare routine, even if I'm on call and can only get a few hours of sleep. I am going to test my luck, brush my teeth, and get to bed and see whether or not I get paged tonight. So let's see what happens. Okay guys, so it's about 1:30 a.m. and I just got called in to go to the emergency department for concern of a deep space infection. So I put on my scrubs and I'm heading to the hospital. All right, all done. Patient did not require an admission, which is great. I was able to do a procedure bedside and they'll get discharged from the ED. We'll follow up with them in about a week or so. A lot of our patients end up getting discharged from the ED, which is really great because we can just help them and they don't have to be admitted to the hospital. I am gonna head home. It's about 2:30 p.m. I wish. It's 2:30 a.m. and I am much slower this time of day. So I'm gonna go get some sleep and then come back for morning rounds. So I will see you soon, you guys. So when I pre-round on patients, you guys, it is so early in the morning. It's not even 5 a.m. And patients really need their sleep in order to recover. So actually, when I pre-round, I only see patients that I absolutely have to see, patients that really need to be checked on for their own health. And then really what I end up doing is going and talking to their overnight nurse to see how they did overnight, because that's actually the most important piece of information I can gain instead of a physical exam super early in the morning when they're drowsy and really sleepy, especially because we're gonna round on them together as a team in just a little bit anyways. And so that's usually my flow in the morning. All right, so it's about 5 a.m. I'm in the resident room. I made myself a quick cup of coffee because that's, of course, very essential. And now I'm going to sit down and take a look at all of my patients on the list, look at their vitals, look at their overnight labs, look at any sort of imaging events that happen overnight, update the list, get ready for rounds. All right, you guys, so I am all done. After morning report, we go around on everyone as a team, come up with the plan for the day, and then everyone kind of assumes their position. Whoever's on call today will take the pager from me, and then outpatient clinic starts soon, and so the day starts again all over. As for me, I'm going to grab my stuff really quickly and head home. It's about 7:50, and televisits start at 8 a.m. So I have to do televisits for the next couple of hours. And that basically will wrap up my call shift. All right, so getting ready to do televisits with my little partner in crime. Ozzy, are you gonna do televisits with me? It's kind of nice to be home for these televisits because I get to be with my dog, spend a little time with them, and I get to make my own food. So I'm gonna have a yogurt parfait with berries and granola, and then start calling patients. And I try to call patients and then do my notes at the same time on the computer, so I'm efficient. I can get through all of the patients that are scheduled for the day. Okay guys, 2:30 p.m. I'm officially completely done with my day. I'm going to actually head to bed, get a couple of hours of sleep, and that wraps up my call. Before coronavirus, we would work a regular 12-hour shift after our 24 hours of house call.
and that makes it 36-hour shift. But now in the coronavirus era, when we do televisits, it's actually a lot easier because we get to go home after morning rounds, and then we do televisits until 2:30. So it's actually a shorter day, not as bad, but that's it. That's my call shift. I hope you guys enjoyed seeing what it's like to be on call. It's definitely a little bit different than a lot of programs, and so hope you learned something. Being on call is definitely difficult, but it's the time where you learn the most because you have to make some decisions and you get to see a lot of different stuff. So I do a lot of my learning when I'm on call, and I've come to really enjoy it. That's the time when you really, really feel like you're doing all of your learning. And so hope you guys enjoyed it with me. Thanks for tuning in, and I'll see you next time.